If you're watching this, that means you have just finished a dental extraction. There's a couple things that you need to know in terms of post-op care and maintenance. Pain. The ADA recommends taking ibuprofen and Tylenol, swapping between the two every 4 to 6 hours, and that should be more than enough for dental pain. Antibiotics are not routinely prescribed. If you feel that after the extraction you are experiencing fever and chills, give us a call so that way we can get you on some antibiotics. Right now you have an open socket. We did place some stitches over it to help heal that site. However, you may experience what's called a dry socket. It's more common to experience a dry socket in the lower jaw compared to the upper, but in any case, we still want to minimize the chance of getting a dry socket. Right now, your body's going to want to form a blood clot. That's part of the natural healing process. However, if you do things with negative pressure, such as drinking through a straw, smoking, or even spitting out forcefully, that can actually dislodge your blood clot. The dry socket is not infectious, but it's extremely painful, so we want to minimize our chances of getting it. In the case that you do get a dry socket, don't worry about it. Come to the office and we'll be more than happy to apply a medicament for you to help soothe that area. Things you want to avoid after your extraction. No vigorous exercises. Even carrying a baby, a newborn, might be too vigorous. It can actually pop those stitches out and can cause some pain. Avoid smoking, anything with nicotine, vaping. Try to avoid doing so for the first 72 hours. You're going to notice that you might experience either swelling or bruising. That's to be expected. Typically by the 3rd day is when you experience the most bruising, but after that it should taper down. When it comes to wisdom teeth, it can take up to a week to 2 weeks for it to fully resolve. When you're in your 30s, 40s, or even a little bit later in life, instead of 1 to 2 weeks for the site to heal up, it can take even up to months for it to fully resolve. That's to be expected. So resume your normal oral hygiene. That includes brushing and flossing. However, you may want to avoid using alcohol-based mouth rinses as it can burn your soft tissue. To promote healing, gently swish around with salt water rinses every night. The stitches that we placed are absorbable and they can come out before your 1-week post-op appointment. Don't worry about it. In the case that that should happen, just make sure you keep that area as clean as possible. If you need anything, just give us a call and we'll see you in 1 week for your post-op appointment.